to express appreciation to all of you for being here. I'm Carl Endefirth, and I am the Wadhwani Chair in U.S.-India Policy Studies here at CSIS. On behalf of CSIS and the Wadhwani Chair and the Confederation of Indian Industry, CII, we want to welcome you all to this lecture that is part of our, I'll do a little bit of promotion here for a moment. This is part of our ongoing series, signature series in India's emerging economy and future. It's a series that we initiated several months ago. Persis Kumbada, my colleague, fellow here at CSIS, is directing this signature series. We're looking at various sectors within the Indian economy that we're trying to shed light on, trying to gain better understanding of, finding ways that the United States can work more closely with India in promoting these sectors, working together with India. As many of you know, the mantra for the Wadhwani Chair is to unlock the full potential of the U.S.-India relationship. Well, we think that the sectors that we have identified for this signature series are all part of that unlocking the full potential. We've had excellent lectures on the Indian energy sector. We've had lectures both here and in Delhi on infrastructure. And today we turn our attention to healthcare, which brings us to our honored guest, Dr. Reddy. We want to thank him again for being with us. He is, as you know, the chairman of the Apollo Hospitals Group, one of the world's leaders in providing health care with over 50 hospitals and paving the way in so many important directions with technology and innovation and delivery of services. And we could not think of anyone better to speak to us about the question of the healthcare sector in India and how the United States and India can work together on this. Now, Persis in a moment will give a fuller introduction of Dr. Reddy, but I thought that I would just begin by identifying just a few points of reference for the discussion that we'll have with Dr. Reddy and hearing his remarks. Just a few points, as I said, to sort of frame this discussion. The first is that the U.S. and India continue to develop ties in many vital sectors, including security and defense, energy, higher education, and science and technology. We believe that greater U.S.-India cooperation in the healthcare sector could and should also be a part of this broader relationship. Secondly, closer ties between the U.S. and Indian healthcare communities would help promote better health, economic growth, and increased access to healthcare products and services in both countries. Clearly, both of our nations are dealing with providing healthcare coverage to all their citizens and finding a way that is affordable to do so. And I think that we can find great ways to cooperate in meeting this. We talked briefly, of course, in the United States, we're having a major debate about healthcare. It's a constitutional debate, it's a political debate, but at the most basic level, it's a question of how can we help those in need that are that need healthcare, and that's something that we can work on together. Thirdly, India's healthcare industry is currently worth $40 billion, 2010 figures, and grew about 40% annually between 06 and 10. India has a 5-year plan starting in FY12 to announce an increase in its current healthcare spending from 1% of GDP to 2.5% of GDP, a recognition of the importance of this sector. Fourth, some of the largest problems to tackle in healthcare in India are persistent malnutrition, rising rates of non-communicable diseases, and limited education and access to basic health care, all ones that we think are important areas where we can work together. And finally, the key challenges facing India's healthcare industry are how to expand access to affordable health care and innovate methods of distribution and delivery to the majority of Indians with little or no health coverage. So These are some of the topics and issues that we think bring our two countries together to discuss. And with that, and also a comment that when we do move to our questions and discussion after Dr. Reddy's remarks, we do want you to please use the microphones. This is being recorded. We will, at the end of this signature series, have the remarks of all of our speakers in a publication with commentary by Persis Kumbata about what are the takeaways that we should be looking at in terms of deliverables, to use a term that's very popular in Washington, that we can be working on. So, Persis, please.
Okay. Thank you, Rick. It is my sincere honor to be able to introduce Dr. Pratap Reddy, who's chairman of the Apollo Hospital Group and the fourth speaker in our Emerging Indian Economy Signature Speaker Series. And for those of you who are not already familiar with him, we've provided a brief biography for you. I'll just hit a few key points. Dr. Reddy is described alternately as an icon, a pioneer, a groundbreaker, and an architect of India's modern healthcare system. From its beginnings in 1983 with one hospital in Chennai, the Apollo Group has grown to include hospitals, pharmacies, diagnostic clinics, medical and nursing colleges, insurance, a health superhighway, and much more. Dr. Reddy has been chairman of CII's Healthcare Committee, Health Council, and National Council on Public Health. He has also been awarded the Padma Bhushan and Padma Vibhushan awards by the Government of India, among many others. As India adapts to massive societal changes, including increased urbanization, changing demographics and diseases, and as its young population demands better education, jobs, and access to healthcare, we have heard from other speakers in our series about the need for expanded infrastructure and energy to power India's economic growth. At the same time, our view here is that healthcare is an equally vital soft infrastructure in any country, including our own. We could not ask for a better representative to discuss the current state and future of healthcare in India, as well as opportunities for cooperation between our two countries. I'd also like to take a moment to thank the GE Foundation for making this series possible, and to the Confederation of Indian Industry for their support in our series as well. With that, welcome, Dr. Reddy, and we look forward to your remarks.
Namaste. Ambassador Carl Inderforth, Persis Kumbata. I am really privileged to be invited to speak on health and the Indo-US cooperations in health. All of us know that there is no country where there are no pain points in healthcare, irrespective of the most advanced countries or the developing countries like India or the underdeveloped countries. But briefly, if you look at what Indian healthcare today is, it's probably what it was 20 years ago here. But then there is a difference. If there are some institutions in the country which have got the same facility as some of the best facilities available anywhere in the world, including the United States. But then the Indian healthcare challenges are major. The first major challenges we have is that where we have inadequate hospital beds. We have one hospital bed for 1,050 people. In US, there is a hospital bed for 250 people, one bed for 250. And Japan is luxurious to have one bed for 80 people. To bridge this gap, we have been talking to the government that we need to add 100,000 beds per year for the next decade at a cost of approximately 50 billion per year. The second major or a bigger challenge that we have is what you all won't believe. You know, everybody says India is full of people and full of young people. You know, 385 million people below the age of 30 But then we don't have adequate numbers of health human resources. So I think this is one, I won't call it as a challenge, I would say this should be automatically be an opportunity to develop this health human resources. If you take doctors or nurses, if you compare with say US, we're at least 5 times disadvantaged. You know, we need to augment the doctor, nurses force or the paramedicals several times over. So and a country should actually automatically look at it saying, here is an opportunity to provide them jobs. So what do we need to, as I said, the CI and the several well-meaning organizations have been pushing the government saying, get this across and let's bring a reform so that we encourage, not regulate, health human resources development. We have done with Apollo, we have this 55, 56 hospitals, but we have 11 nursing colleges. We felt this is inadequate. We need to double this. We train about 3,000 to 4,000 paramedics and the whole caliber. We feel there is an opportunity for us not to double, triple this, to take it to 30, 40,000 per year. I think this is what the country next should be doing. This is our, what we had been asking the government is to facilitate health human resources development. For that, year after year, thanks to CI and all other bodies, we have been submitting a memorandum to the Ministry of Health, Ministry of Finance, Planning Commission. Discussions have been going on. In one request that we have made is saying that please give health and education a national priority. Give us the priority status. And you see that happen. I know some of you here represent the IT sector. When they gave IT 14 years ago, the infrastructure status, and similarly the roads and all other things, you have seen the significant development. The development, yes, not because of the people developed in IT, not because the companies grew globally, but it has contributed to the national economy. It has contributed to giving that number of jobs. I think that will happen several times more if only the health and education is given a national priority. Unfortunately, you and I know the governments are not doing it because they feel it is the obligation of the government to educate its people. It's the obligation of the government to give health for its people. Although they have realized that they cannot, even most advanced countries like here, you all know how much the government is facing to give health care for all its people or education for all its people. We should learn from this experience and say, if it is, why not give them an incentive so that they could and give them whatever we are asking is simple. It's not tax loss to the government, it's a big gain to the government. So we hope one of these days and soon, hopefully even next month, when everybody has great expectations that a lot of reforms will happen under the dynamic Prime Minister in the month of September. I hope this would happen, and Dr. Shah and everybody will join me, and CI has always been very supportive of this. So I think this is one of the things which is very essential to make the next leap in providing adequate health care by having adequate number of people to man this. But we have a third major challenge, which is I think is frightening. We had this infectious diseases before, which was frightening. Fortunately, some of those major things like plague, cholera has been controlled, and WHO gave us a certificate recently saying India probably is free of polio, and that's because of the government effort to do the immunization program. But we still have 40% of our deaths occurring from communicable or infectious diseases. we need to rapidly address this issue by way of adequate prevention, adequate vaccination. You know, India is proud that as far as the vaccination industry is concerned, they are producing enormous amount of vaccines. I understand that last year it valued at about 900 million. They are exporting 40% of whatever they produce, and UNICEF is one of the main source through which the rest of the world, 100 countries, are being benefited by the vaccines that are produced in India. And I also met another entrepreneur in Hyderabad the other day. He said he's going to make a vaccine for hepatitis, to prevent hepatitis C, for almost costing a few cents a shot. So I think these are happening, but what we need is we're looking forward for the greater thrust in development of these, so that it can meet what these are all, communicable diseases, infectious diseases are preventable. Are preventable if adequate steps are being taken, and you are experiencing it here. And what you are hearing here is your biggest problem is the flu and the modified flu diseases. For that, immunization is effective, but still we have other serious things which we need to address the issue. But we have a larger issue. The larger issue that India faces and other Asian countries are facing is the non-communicable diseases. You're all aware, the UN had the first summit on non-communicable diseases last May. The health ministers of various countries came, they all listened, they went back, and you know what it is? As far as India is concerned, I was telling them recently, tomorrow Olympics starts, and you want to win a gold medal. But India has won 3 gold medals. We are the heart capital of the world, cancer capital of the world, and diabetes capital of the world. I don't need this. Ambassador, I would like to throw this in the Bay of Bengal next door to me, or take it to the Indian Ocean and throw it. So I think it's a terrible problem that we are facing with diabetes. Whatever numbers that were talked about in 2000 was far exceeded by 2010. India and China racing to there by matter of a few numbers as to who has the largest number of diabetics in that country. But it's by 2020 they expected that there will be 36 million Indians who have diabetes. But by 2011, the statistics reveal that we have already crossed to 75 million, and it's estimated that 1 out of 5 diabetics in the world will be an Indian. It's not a pride to me. It's not something which I'm proud, what I'm wearing. And I think this is where we need to tackle. Similarly is our problem with the other two, the cardiac. I'm a cardiologist. The entire concept of Apollo came in because I was a cardiologist when I was practicing cardiology. When patients needed surgery, there were not adequate facilities in India. I used to send my patients abroad. One of those days, I lost an young man. He was only 38-year-old, leaving behind a 31-year-old wife and 2 children, 4-year-old daughter, 2-year-old son. Seeing that sorrow, saying how many more, and you know why? He couldn't raise $50,000 to come here. Looking at that and said, how many more families are going to face this tragedy? To fill that was what came out as our vision of Apollo, to bring quality health care to reach the various cross-section of our people. I think we have to some extent, we have succeeded because we are doing the same quality outcomes as any hospital anywhere in the world. If it's heart, we've done 129,000 or 130,000 coronary bypass surgeries, and our outcomes are the same as the best institutions anywhere in the world. What we are happy about is, for the lower income group, we charged $3,000 on day 1. Even today, for the lower income a patient, it still costs him only $3,000 for a coronary bypass surgery. His outcome is still 99% plus. So I think that's similar in almost all disciplines. But what's needed is it's only available still for a limited population. There are 1,000 such hospitals, good hospitals that are now in India by various groups. Maybe we started, I always say this, in 1983 when our hospital was started, inaugurated by the President of India, Gnani Zail Singh, that was the end of my beginning of my problems. How many were my problems? My problems were equivalent to the bricks I had in Apollo, 1 million. But I think they are behind us. They have become now the strength for us to grow for whatever we were able to gather. And now we believe that in all of these three diseases, in diabetes, cancer, and heart, we should work as a unified group, not just India. I think we must credit US for whatever we are, and in many things, but in health we all accept that the great developments that took place here in technology, in diagnosis, in methodologies, in research, in new innovations, in all of these there is a great institutions in this country which have done enormous work and continue to do a lot of research and innovation. This is where I think we need to take this huge resources that are available, and the rest of the world should work. So I was telling our ambassador, I was hoping to meet the World Bank presidents and see where the WHO and World Bank and governments of the 50, 70 countries who have this acute problem with this present day's health crisis could all meet and see how do we find a common solution. Where do we bring the translational research to the patient? What are the new tools that are available? There's a great thing that's happened in the last decade, that is IT. How can we use the benefit of IT to transform delivery of healthcare? We have done recently, 2 months ago in Hyderabad, there was an IT conference attended by almost who is who in the world, transforming healthcare using IT. I believe everybody was saying, yes, we have all of these tools, we can bring this together and make a single difference. At Apollo, we believe that we should change healthcare delivery, integrate the healthcare delivery from the hospital to the clinic to the home using the IT. If that's what it is, I automatically release 70% of my beds available for the serious patients. So I think this is no longer a dream. I think this is something that we need to be able to bring each other's help. Like for example, here you brought electronic medical records. I don't see why the rest of the world could do. The Indians have helped, in bringing this electronic medical record system, including our own company, Apollo Health Street. Why shouldn't the rest of the world now not do this? The initial costs of what? I remember, one of the leaders in India used to say, when they wanted to connect all the rivers in India, all the officials said, no, it cannot be done. The reason is what? They said it costs too much money. That leader said, whose money, who are you spending? Like that here, this is not the cost. It is the pooling the resources and making this happen and see what is this outcome. I think that is the single answer that we need to look at, bringing all the efforts that are available. There are so many wonderful innovations, research that's happening in every single field in the West. I know what's happening in Europe. I know many things that are happening in great institutions in the United States. We need to take this. We need to take this and say, we don't have to reinvent. Let's be there where they are and see how we can bring this back for the benefit of people. This is where I think I appeal to the CSIS and our ambassador, who has done a lot to develop the Indo-US relationship. I've also been part of this, I've been the Indo-US CEO forum, 10 CEOs from there to here. We did a few things, and there's been a great help from some of the major universities here in creating public health institutions. And I think if, with the help of CSIs, how can we bring these and bring that? And sometimes they are saying, is it going to be a one-way track? My answer is no. Because the world existed before this technology. The world existed before all these medicines that we have today. So I think we need to see what is the holistic approach that we have. If we can develop a holistic approach, we have what's it called, a CSR program called the Billion Hearts Beating. Because this is one of the major steps that that Apollo has started, but I think now it's an initiative which several organizations are joining. What do we do in this? We're trying to bring this awareness into people and then say, hey, you don't have to die at a young age at 30 with a heart attack, or you don't have to suffer with the complications of diabetes, or you shouldn't get cancer for no reason just to be fashionable to be smoking. Throw that death stick away, control your diabetes and hypertension, and most importantly, grab the relaxation techniques which you have exported to the West, import the yoga and meditation. So I think several of these things will make a very significant difference. And as I said, if those ages, if they have existed, some of those ancient medicines still are available for many things. We have no cure for rheumatoid arthritis. But if you go to a place called Kerala, they cure your rheumatoid arthritis. In our terms, they will tell your rose water is 2000, you've got a very, very advanced rheumatoid problem. You take steroids forever. Steroids are good because they suppress everything under the sun and cure none. So I think here are the guys who have cured those. And I was telling about my own fracture. There's one of the world's largest fracture clinic. All that they do is they just pull you this and then put a paste on it, and you go and that gets healed. So all of these were available. Chinese has got a tremendous amount of ancient medicine. They were telling in Cambodia has. So I think we need to look at saying what is the ancient medicine. How can we bring holistic approach in this? This is what I think we can give back to US, saying yes, you are the most advanced country in everything, including healthcare. But I think what is needed is, can we go back to some of these which are no side effects, less expensive. We don't have to spend 15% of the GDP. Or our country increased, as a great thing. Everybody was very happy on that day, saying that we increased our GDP expenditure on health from 1.5% to 2.5%. That is about, a few thousands of crores, which probably won't even help our inflation or help us to do the to renovate the various medical facilities in our country. But still must admire them that they did something. But what we need is a global attempt, and this is where I hope, under the ambassador's guidance, and of course if Persis takes is the thing, she'll make it happen. She didn't give me a chance. The moment they said that CI said, yes, Dr. Reddy is coming, from then on she's got it confirmed that I had said no say, and she also said what all I should speak. But I think it's a great honor to be here with you. I can go on speaking because the problem is big, but I can speak with greater enthusiasm because the problem is solvable. But how can it be solved? India cannot solve it, US cannot solve it, you and I cannot solve it, but together we can solve it. So I think that's a magic thing that's we need it. If we do that, we would have transformed not only today's people, but would have given back for the next few generations of good health. All that we are doing is mending our hearts, mending all the, replacing the knees. All of these, I think we could also think of saying a great formula. And the IT is going to make a very big difference. It's there now. What is needed is to grab it and give the full potential to make that transformation in health, better health for a lot of people. Thank you, Master. Thank you.
We have about 20 minutes. I'd like to, now I realize this may sound a little bit frivolous, but I'll do it anyway. And that is, I recently saw the film, The Best Exotic Marigold Hotel. Have you seen this? Okay. It is about Westerners coming to India for what some refer to as medical tourism. This is also medical retirement. That's the theme of this. But it raises the point about containing costs, about doing things for less. I think the figure is that surgeries, comparable surgeries done in the West and India, that it's 1/10 the cost to do comparable surgeries in India than in the West. In the film, you'll see
with equivalent results.
I'm sorry?
With equivalent results.
Yeah, of course. And what we're facing in terms of all of our countries, all the advanced countries, is learning from on a global basis what India can provide in other countries that are doing a more holistic approach. You do need to see this movie, by the way.
Yeah,
Judi Dench and others are in it. It's a great story, but it's also a successful story about how India is approaching, in a very compassionate way, approaching ways to provide healthcare services. So, with that slightly off random beat introduction, let me start, and I will go to Aziz Hanifad, India Abroad. We'll start there, and then we'll work our way through the room.
Dr. Reddy, it's good to see you again.
Thank you.
I remember covering you when you used to be a practicing physician in the US, and I remember the doubts that were raised when you decided after about 25 years to go back and start a group and as good or better than the Mayo Clinics of the world, the sort of cynicism and everything else that were there at the time when you had this optimistic, altruistic outlook. But Apollo has grown, it's huge. You all have even expanded to some of the South Asian countries. But there is criticism in certain quarters that for-profit groups like Apollo and others haven't done enough to alleviate sort of the tremendous health disparities among the lower classes, the poor, the indigent in India. And that you all are more interested in medical tourism, the sheikhs and the emirs who instead of coming to Mayo now come to Apollo and the Hindujas. How do you address these social disparities and health infrastructure needs? Because it is not just medical tourism for the guys who want to do bypass surgery in the US, but the masses of India who have tremendous needs, and for-profit groups like Apollo are criticized for not addressing those needs.
I'm glad I'm not standing for the vice president's post. It's a very wonderful thing that you have asked, saying everybody when they're in despair or distress, especially medical distress, you should give a helping hand. And I don't know of any doctor who refuses, although the doctors are most criticized. But people don't realize that this is the guy or this is the lady who goes at 4 o'clock to do a delivery in somebody else's home or in a nursing home. So with all of these, there are some pitfalls saying, you are not caring for all, and why are you caring only for a few sheikhs? Truly, whatever that we have done at Apollo, let me say, I'm justifying, what we have done is a quality health care given with compassion, but it is sustainable. For its sustainability, I think we need to have, from day one, we have 3 components of care, people whose things we address. And that's what gives us the conscience saying we have not neglected. As I told you, $3,000 for a bypass for a lower middle class person is not simple, but his outcome is the same. But your question is, why can't we do this more? Why neglect medical tourism? But if I neglect medical tourism, my very concept of doing this is wrong. Why did I do this? Indians were coming here because those facilities were not available for people back home. So if there are some people who are not for whom facilities were not available, and if they trust Indian healthcare and then come, I think this is exactly the reason why Apollo was established, and the whole concept was built around it, saying that you need to build high quality healthcare and give it with a cost benefit. So if you call that medical tourism, it is true. Second thing is, we must now believe, I just finished saying, we should now develop a global health, where we should take the best of all of the systems and from all of the people and build it. So I'm not saying sorry I didn't do this. I think every bit of it that we do is towards that goal of reaching as many people as possible, but definitely with the quality outcomes.
I think I will address your question, and thanks to Dr. Reddy. The most important thing you have done in India, and for people like young people, that what is considered to be impossible is possible. Based on that, your point that you made is the training. Recently, Planning Commission published a universal healthcare, and the number of trained workers falls below 0.01 per thousand.
Yeah.
So they set a very modest goal of 1 trained worker per thousand, and money is going into the Planning Commission. So to the point that you are making, exactly the thing we are doing. I belong myself and Suresh and I belong to a group called IIT Alumni. We have formed a Wills Foundation in this country and partnering with CSIS in this area of the education. One of the things we did from 2006, now we are branching into health. And this is why I think you made an absolutely good point. We cannot do it alone. We got to have a holistic, global approach. So we have formed a partnership with API, which is the American Association of Physicians of India, and taking up a model that API has demonstrated already in the state of Gujarat in 26 villages called Project Seva. Very young people are being trained to give a very nominal healthcare in the villages. Now we are combining 2 of us into a 3rd group, which is also established in India, called Public Health Foundation of India, started by a few alumni. Bill Gates gave money and government matched the money, which is state 4 public health institutions in 4 regions of India. They're developing the content. And Professor K. Srinath Reddy, whom you probably know, he says, how do I take my knowledge into villages? And right there comes the point you made, IT. So now we are looking at technology to create equivalent to like virtual doctor's office. We have enough doctors and nurses not available, so through the training, how they could then contact experts in cities and get equivalent to some help to the rural centers. So this thing is already started, and the point that you are making is absolutely right point. First, collaboration. Secondly, IT. Third and most importantly, look at the resources that we have. The millions of people and millions of need. So thank you very much for the wonderful lecture that you gave.
And I admire what API is doing. Here, Navin Shah is here, one of the originators of API.
That's right. It's excellent.
I was the recipient of API. Now, along with API, we have formed another association called the GAPIO, Global Association of Physicians of Indian Origin, so that we can pool the talents of the world. I still believe we need to bring the global, the best of everything, and this is how GAPIO has been formed. We had a meeting in New York 2 days ago. Thank you for the advice.
Just to expand on what Hiten just mentioned, One of the things that the alumni of the IITs have done is to sort of promote a curriculum among the engineering schools to sort of train the future healthcare providers. And IIT Gandhinagar is one of the first ones to actually develop a formal program. So one of my questions to you is that how would the private sector hospitals in India, such as yours, participate in a program like that, where you collaborate with the training institutions to sort of develop the technology and the training infrastructure going forward?
I think it's very important. We need the, the doctors are, can't manage. We need professionals to help us. I've been looking at this. We have talked to IIM Ahmedabad. They are giving us some help. We're also participating to some extent with them. I'm talking to ISB now. Analjit is starting ISB in Punjab. There's a basic health is also one of the major programs that they're going to conduct. But the point is well taken, because we can't run a hospital without professionals. It has to be a totally thing. And the age-old system of India, a good doctor became a medical superintendent, and that doctor became a medical director, and then he became the Director General of Health. He had no idea. And we lost a good doctor and got a bad administrator. We're trying our best to cooperate with them. We are in touch with IIM Ahmedabad. We are working with ISB. Actually, I think there's a program next week with ISB.
So that'll be great if there's a more formal way of sort of making
We are
it
very
more
keen,
inclusive.
and I know Analjit is doing this in his new ISB in Punjab, where health is going to be one of the major subsects of training.
Thank you.
Don Camp?
Thank you. Dr. Reddy, the World AIDS Conference, as you know, is taking place in Washington this week. And the Indian pharmaceutical industry is well known as a source of inexpensive antiretroviral drugs and the like. I wonder if you could just talk a little bit about the state of treatment and prevention of AIDS in India today and the Apollo Hospital's involvement. Thank you.
First, I must appreciate the great work done by Bill Gates. I still recollect 4 years ago, I think, when he came, called a few of us, and first they were all asking, even the media asked, how much are you going to donate? When my turn came, I told Bill Gates, you should also ask the media a question, saying, why aren't they giving few minutes of a day in bringing this awareness? The only way that we can control AIDS like any other disease is to bringing this awareness to people. They don't know the horrible after effects of contacting this disease. So I think if this could be brought out, will be our major this one. Of course, by treating them, we are preventing him communicating, giving the disease for others. But as far as Apollo is concerned, I think we are trying to. We have some roadside with we had till yesterday we had ambulance services called 1066, which would be called, but suddenly I understand that they have banned 4 numbers. In the country, the word emergency was described by us. Previously, it was called casualty. So you know what casualty is. So we changed that, and we converted the ambulance not as a transport vehicle. We converted ambulance as a mobile hospital. So through that, whichever on the roadside, these help also the truck drivers, some amount of education. We have some films. So we do a small in that huge game. Yes, ma'am. Please.
Dr. Reddy, I'm Yashwant Raj from Hindustan Times. How much does Apollo spend on medical research, and in general, how much do private sector hospitals in India spend on medical research? The general feeling is not very much, and so could you please?
I think we are, I must admit we spend very little. We hope that we will increase dramatically this. We have 3 good people whom we have taken. Professor Ganguly, who was retired as the ICMR director. We have Professor Rai Chaudhary, who is an eminent scientist. And Sita Nayak is one of the best nuclear molecular scientists. We have developed put a building at least and equipped it in Hyderabad. We have been one of the largest clinical trials. If you take as Quintiles as one of the largest clinical trials company, they have a facility with us as a joint partner in Hyderabad, which is bigger than their other facilities. They have 3 facilities outside India. The first one is in Kansas, second is in Norway, Sweden, I'm sorry, and third is in Guy's Hospital in London. The fourth is in our facility in Hyderabad, which is, according to Dennis Gilling, he says, Dr. Reddy, and told the press that this facility is bigger than all my facilities, much better equipped. So I think we are there. But your point is right. We need to do a lot. We are talking to this trip of mine is basically with that to see how do we collaborate with some of the leading institutions which have done a lot of work to do this. Percentage wise, I'm asking my board saying that an X percentage should go towards this, to the research. So far what we have done is very little. But if you ask did any outcomes come, 0. I don't know, even after 10 years, even if I invest quite a bit, if I'm going to expect saying that my research will pay off, I don't know. But I think our intention is very clear that we should advance, take it, because we have the patient population which nobody has. Our hospitals are situated in major metros, small cities, and in rural areas, and we do a lot of rural camps. So the tremendous. I'll give you a small example. I have a hospital in Bilaspur. Exactly 5 miles from there is a village. We did a study. Not one in that village have touched allopathic medicine. So I think we have this varied population, varied gene pool, various caste creeds. So I think we are in a good position to do that, and we think we will put our best efforts into it. I hope some results will come.
Next to Kasma.
I'm Krishna Banada from George Washington University. I welcome you, sir, here. And thank you for joining the signature lecture series here. I'm a director of Ayurveda in St. Lawrence Institute. I'm glad you advocated the use and the use of the herbal products and complementary and endogenous products for cheaper and safer health care. And I am also involved in tuberculosis program in India. Last November, I was with Dr. Chaudhary and Dr. Ganguly and Dr. Sita Nayak to start something in Apollo hospitals. So it still is going on, but my question is how much the Apollo hospital is involved with the government for the tuberculosis management and prevention.
I wouldn't know. You mentioned the 3 names.
Yes.
They are my big bosses, and they don't need my permission. They have pure autonomy we have given them. So I hope they are doing good work.
Yeah,
I'll check with them when I'm in Delhi next week.
Thank you very much.
Please.
Thanks, Dr. Innovating.
Hi, my name is Sheila Lal. I'm with the National Bureau of Asian Research. My question is regarding generic medications. I know there have been talks between the Indian and U.S. governments about that, and recently Amir Khan's show Satyam Ajit, they talked about it, and it's and why Amir Khan thinks that we need to use more of them, or Indian hospitals need to use more of them. What is Apollo Hospital and what are the pharmacies doing with regards to generic medications?
I think you have asked a very good question, and which is very relevant. How do you get good medicines or medicines which work for some difficult problems, if the cost is not, cost is very high. So I think the fact that generic medicines developed rapidly was purely because that it was needed in countries where there was no health insurance, where the paying capacity was very little. So, but I also agree with the 2005 Patent Act, which brings some amount of regulatory mechanism so that developers are not punished by whatever mischievous formulations. So it's needed. It came out of a need because the developing countries could not afford some of those costs. I know very well. We used to give some of these vaccines which used to cost about 1.5 to 2 lakhs a shot, and it's come down to nothing. For a heart attack, streptokinase, we used to spend 58,000 rupees per injection. Today it costs 5,000 rupees. So I think some plus minus, but I'm not an authority on generics, please excuse me, but I still feel, I look at the patient saying, if you can't afford, don't deny him the treatment that might make a difference in his life.
Could I ask, there was a item in the New York Times 2 weeks ago saying India weighs providing free drugs at state-run hospitals. Can you tell us about
Yes.
that?
I think it is the Rajasthan government which said that 18 drugs, they are getting it manufactured from the generic manufacturers, which have brought down the cost tremendously to even a fraction of the cost of the generic medicines itself. So I don't know how it's working, so there is no adverse report so far. But if it's working and if it's helping people, I think I admire them. The government of India first, in the last budget, the Prime Minister announced that their 50,000 crores is going to be left to provide for free medicines for people. First they announced the amount, but the most recent amount is that these are going to be the drugs that are going to be available. And I believe most of these drugs are the same route which they are taking from the Rajasthan government. They are the first people who started this, and I sincerely hope it is not the cost that should dictate it. It should also have the quality, that it should serve the purpose of the sick man, because there is no taking back. If you had a patient with an X infection, if you give a medicine which is not applicable to him, you can't retract it. So I think they should be very cautious in administering this policy. But it's a great initiative when they said they're going to provide 50,000 crores first, and the next thing that they announced was this, that they're going to give free medicines available for all the hospitals, for all patients.
It's kind of like Medicare Part D. Indian stuff. Yes.
Namaste, Dr. Reddy, and thank you to CSIS. My name is Sudha Shivram. I am with the Center for Global Health at the National Cancer Institute here. And I would like you to, sir, if you will, elaborate what your focus areas are going forward in cancer research, and how do you see what your vision is in terms of Indo-US collaboration in cancer research? And if I may say, I'm a Chennai girl, and so it's an honor to see you in person.
Thank you, thank you. I think you asked one of the very relevant thing. As I said, that's one of the gold medals. The second cause of death is cancer, and it's increasing rapidly. The last figures we saw, out of 1,000 deaths, the difference was about 40-50 between the two, but this is rapidly catching up with cardiac deaths. What is being done today is, first, we have the facilities in India today, at least in some parts, to make good diagnosis. You know, you need all the technology that's been developed here, including the PET scan, so on and so forth. So we have that. We brought the first PET scan to the country, PET cyclotron, first PET CT. But today there are at least a couple of hundred PET CTs across the country. Then when it comes to the management of the disease, I know the Apollo had the third LINAC in the whole country, which is today has over 250 or 300. And the government has announced that they're going to give 2,000 LINACs. I want the minister saying your 2,000 LINACs giving is great, but there are not enough physicists. First train the people. We need the physicists, we need the medical and radiation oncologists to handle this. So I think that part of it is there. We have whatever technology that's available except the proton in management of cancer is available, and the proton also I awarded 1 month ago. So that's the modality is available, but your next question is very important. What are we doing on research? Before that, I would say, what are we doing in screening this? I give you again example of my village. My village consists of about 2,900 people. Out of that, 900 odd are women, and in that more than 40% are people above 35. So we screened those ladies. The first year we found 6 ladies with stage 2-3 disease of the cervical cancer and 1 breast cancer. And that's now this is the 7th or 8th year. God's grace. Last year they found no one who needed hospitalization. They needed simple cauterization or a lumpectomy. That was done last 3 years. So I think that screening program is a much more needed in our country. We are doing a lot of rural campaigns in oncology screening, but I think what is needed is nationwide. This should pick up, and this is what we're asking the government, and this is what he has promised, health minister, that he's going to do 100,000 people, 100 million people are going to be screened for cancer. Has he even promised that he's going to give 100,000 rupees for treatment of this? So it's a wonderful thing when that gets implemented. As far as research is concerned, I'm sorry, I don't know what's happening. I left my bosses, and if something it is, I'm going to check with them.
The last part of her question had to do with U.S.-India collaboration.
Oh, okay.
And could you just broaden that out to say what would be your 2 or 3 top priorities in the healthcare field where the U.S. and India can and should collaborate? We have a number of initiatives underway, but what would be your 2 or 3 top priorities?
You know, I've been talking to some of the leading institutions here. Recently, I was at Mayo Clinic a week ago. Yesterday, I was at Joslin. I have seen the impressive work that they are doing in research and innovation, and expressed my wish, saying that we need to collaborate in this. And their answer was also positive when I explained it to them that we have this large number of population who can become, tools for us to quickly try bring the translation research to the patient. So I think there is some interest. Nothing has been really worked out, but I think as to country, we request CSIS and our ambassador and Paige is to follow this through so that we have this great collaboration. We've been talking about it. There are some. I also saw CSIR, the Director General, who was at Mayo Clinic, and he was with a smiling face and then told me, Dr. Reddy, when you talk to them, you tell them that I went back here happy. So obviously, there is some collaboration that has happened with Brahmachari in CSIR. So I think there are individual things are going on, but what is needed is, if we say, hey, let's go all the way, let's make it a global platform where you bring in your best, we'll bring in the best, we will investigate and put all of this and take it to the good of all people is what I think is the ideal thing to happen. I hope it happens today, because every minute that we delay, we are denying the fruits of research, the fruits of the today's healthcare for people.
We're running a little over time. We're going to continue to 2:45. If anyone has an urgent matter that you have to attend to, please you may quietly exit. So a question here and question.
Pushpa Tandon from NCI, the Cancer Institute, Cancer Research, National Cancer Institute. I'm in the cancer imaging program, and we are trying to develop or support the development of low-cost technologies, which we think would be very useful when screening for patients. In India, as I see it, I'm from UP, which is getting to be one of the worst states these days in India, sorry to say. But by the time the patient comes into the clinic, they're already at stage 3 or stage 4, and it's really late. It's very hard to do anything at that time. So from our perspective, what we think would be very beneficial is the development of cheaper technologies that could be taken to the villages to the suburban areas, rural areas, for early diagnosis, just screening. And is there any effort by Apollo to support something like that, or bring that into, think about that and have a collaboration with NCI or any other organization here who is interested in something like that?
Thank you. I think you gave the question and the answer too. So,
No, but
the answer is, first we commend you, because I think if you look at the big institutions, whether it's Sloan Kettering or MD Anderson or Tata Memorial or Apollo hospitals, all of these, our 5-year survival rate of patients that come to us is still below 40%.
that's right.
The reason being, all of them come to all of these hospitals in stage 2, 3, 4 stages. But if we do what you are saying and do the screening, I'm sure we can turn the results into 35% to 75%. So, but what's needed, I think, is preliminary. And cost is one, which will make a significant difference to take it easily. And if we can make it saying that we can easily train people, because in India there is a great tool which has been established by the previous NHRM, that is the ASHA worker.
Yeah.
You should make that ASHA worker be able to screen, and because she is already familiar with those ladies, for that 600 to 1,000 ladies in that area, she is already familiar. If you can make this tool work with her, we are trying. Most of the people who are now doing our rural screening are no longer from our cytology department, but these are people who are training.
So is Apollo thinking about setting up collaborations with NCI or other institutes here, or companies in India to bring for the development of these low-cost, cheap technologies? And especially, as you mentioned, with the IT, development of IT, that goes a long way in using the just simple technologies of cell phones for screening, imaging. It's just phenomenal what is coming up, and I think India has a big role to play because there is a need for it, and there is expertise, amazing IT expertise in India.
We'll do with you first.
Thank you. Raghuveer Goyal from India Globe in Asia Today. I have 3 quick points. One, how serious is AIDS problem in India? And second, as far as ancient medicine is concerned, you talk about that.
Pen?
Ancient medicine, sir.
Yeah.
Are you taking this case with the Obama administration as far as this collaboration is concerned? And finally, as far as this, since you have returned to India and you are happy, I believe, India has produced more doctors than any country in the world. And they left India when Indians needed them, and Indians need them even again today. Do you think there will be a reverse, that they will go back to India? Thanks, sir.
You know, I think as far as your last question is, there was once one of the governments who wanted to ban doctors going abroad, So I told them, you should not discriminate just because he's a doctor. If scientists can go, engineers can go, doctors should go. But what we should is to create an environment where they can work and have a satisfying working environment for them. I think that's what's happening. When I told you a month ago when I was in London, 370 doctors. That hotel was full. They didn't prepare the lunch for so many people. So I think there is even from here, I've already seen 10, 15, and probably before I leave, I'll see another 10 doctors who are willing to come back. So I think what we need is, he's like anybody else. Yes, he needs living standards, but in healthcare, he wants that infrastructure, saying, I have learned all of these. When I went there, everybody laughed at me, saying, what are you going to do here? You did all the training there. First you won't make a rupee. Second thing, but I think that is no longer there. The infrastructure is available for him to work. So the second, as far as the drug is concerned, whatever you wish, our wish is the same, saying that we should bring the hidden wealth, ancient hidden wealth in medicine from all of these countries for the benefit.
And finally, the AIDS problem in India, sir.
Yes, I think like everywhere else, I think there is a little containment on the disease. Awareness is increasing. Hopefully that is going to be the answer. The great awareness programs that is being done, and there are a large number of NGOs who are working on this. It is not as frightening, or probably I don't think that we are giving less attention to it because we have bigger problems that are facing the country in healthcare, like cancer and heart and diabetes. But I think certainly that threat that it's going to become pandemic is contained.
Well, Dr. Reddy, you said earlier about the 3 gold medals that you wish that you could throw into the Bay of Bengal. This is not a gold medal. It is something that we do not want you to throw into the Gulf of Bengal. It's a small token of appreciation, a glass paperweight, CSIS paperweight. But we want to thank you so much for coming to share your experience and your thoughts and your advice with us. And we hope that we will be able to do, I think you've given us several things that CSIS is now, you've tasked us to move ahead with certain things, and I hope we'll be able to do that and continue working with you. But thank you very much.